I'm Dr. Tammy Gilbert. I am a physical therapist. I've been a physical therapist for 16 years now. I'm board certified in outpatient orthopedics, but more importantly for you guys, I am a scleroderma and pH survivor, 16 years. So I bring to you this lecture from my professional background, being a doctor of physical therapy, but also as a patient myself. So everything I'm going to talk to you guys about today, I incorporate into my own life. So the main things we're going to be talking about today are posture, which is probably hard to do after a long conference day, and you really do not want to be talking about good posture. But we're going to talk about good posture, bad posture, and we're going to talk a lot about how breathing can make you feel better overall, and then just kind of discuss some ways how we can incorporate exercise into our daily lives. All right, so this is a spine that shows you proper posture. There's 4 curves. The cervical spine here goes inward. The thoracic comes outward. We have a nice curve in our lumbar spine that goes in, and then the sacrum comes out like that. All right, poor posture. I think we all probably familiar with this one. This probably looks like us on our computers. So you can see we got the forward head, rounded shoulders. Our mid-back here goes in this rounded posture like this, and then also our lumbar spine goes rounded. This is getting more of a problem today as we're spending more time on computers, nooks, playing all of our games on our cell phones. All right, so how does this bad posture going to affect your body and maybe cause increased pain that maybe is not really related to the scleroderma, but just to your bad posture? So when your neck is in this position here, and I actually kind of almost see patients like that in my clinic, and they come in like, why do I have neck pain? You can get TMJ, jaw symptoms, so a lot of us do have problems with opening our mouths, not being able to open all the way. Some of it's just related if we're in a forward head posture. Also, headaches is a big problem when it comes to a forward head posture. I see tons of patients with chronic neck pain and headaches all the time. If I cannot get their posture corrected to get them out of this forward head posture, I'm not going to get rid of their pain. All right, rounded shoulders. So how does this affect our shoulder joint? So we're going to do a little experiment here. I want everybody to go into a slouch posture. We all know this posture. All right, now in this posture, I want you to try and raise your arms for me. And I just want you to see how it feels, pain, how much motion you have. Don't move your arms. All I want you to do is sit up. Look what happens to your arms. Okay, you can put your arms down. So you can feel a difference when you're up in an upright posture. You have a lot of more motion in your shoulder joint, and it probably doesn't hurt as bad. When you're in this rounded posture and you're trying to lift your arms up like this, we're going to get things like shoulder impingement, bursitis, tendonitis, rotator cuff tear. We all have this. This is not related to scleroderma. This is just related to poor posture. So the first thing I do when I have someone I'm seeing for shoulder pain, they tell me they have impingement or bursitis, the first thing I do is work on their posture. Even if they're sitting at their computer and they're like this and they go to reach for something, they're going to have shoulder pain. I have to get them sitting up nice and tall to be able to reach forward, and it takes the pressure off all the shoulder joint muscles. All right, thoracic spine here, and we're talking about this kyphotic spine right here that's walking like this. This has a huge impact on our life. If you're walking like this, you're going to walk slower. Your balance is going to be affected, which means you're going to be at increased risk for falling. How many of us see the little old ladies kind of walking like this with their walker? Okay, and they're going to fall because they're halfway to the ground. So I've got to get them upright. This also comes affecting our breathing, which we're going to talk about in just a little bit. All right, lumbar spine. That probably looked like me working on my notes Friday afternoon when I'm really exhausted. Unfortunately, when you're in this curvature here, this is going to cause compression on your disc, and this is the disc right here. And what can happen is it can pinch out onto these nerves. And when you get nerves pinched, that's going to give you your numbness, your tingling, your sharp shooting, radiating pain. If anyone's had that, everyone knows what nerve pain is. So one of the treatments for a bulging disc is getting patients into a full extension position. People come into my clinic all the time, yeah, I have a bulging disc, I have a bulging disc. The thing about bulging disc is disc heal. They've taken people who've had a bulging disc, they've done MRI studies every week for 6 weeks after they're doing a physical therapy program. At the end of those 6 weeks, the disc is back into its normal shape. So just because you've been diagnosed with a bulging disc does not mean your life is over. That disc is going to heal with proper rehab and proper exercises. It's not a life sentence. All right, so this is a good way to kind of think about your posture. Are your wheels aligned? So this is good posture here, and you can see all the wheels are lined up. So if you have 3 wheels and you're trying to spin them, if they're all lined up, it's not going to take much energy. You can do it easy, you're not going to get fatigued, and you can go all day long. If you're in a bad posture here, that's going to be a hard time trying to get those wheels spinning. So what's going to happen is if you're trying to spin your wheels, it's hard work. You're going to get tired, you're going to fatigue. You're not going to be able to go as long, so you're going to have decreased endurance, and your muscles are going to start to hurt. So if you're walking around all day kind of like this, or if you're sitting all day like this, your muscles are not in the best position to do their job. So you're not going to be able to go as long. People are like, well, I get tired after I'm sitting for an hour, or I get tired after I'm standing for an hour. Well, if you're standing in bad posture, yeah, your muscles are going to get tired. All right, so this is just a nice summary. If you're spending 18 hours a day kind of sitting like this, and then you try and stand up, you're going to end up looking like that. And when you're walking like that, everybody relates that to old age, because that's what we see our grandparents and little elderly people walking at. Also, when we're up nice and tall, this is a posture of confidence. In scleroderma and pH, it takes so much away from us, and I think it kind of steals our confidence because we've been given all this stuff, you're going to have this, you're going to have that, and your life is going to be diminished. Well, you know what? Stand up, be confident, and say, you know what? I've got this disease. It doesn't have me. I got it. Posture. All right, so how does posture relate to breathing? So we're going to talk just a little bit about the diaphragm. So this is the base of your lungs right here, and then this is the diaphragm. So it's about right here, okay? What has to happen is this diaphragm has to be in the best position in order to function properly. So that goes back to, are your wheels aligned? If your wheels are not aligned, your diaphragm's not in the best position. So if your diaphragm's not working the best, your lungs are not going to function in the best way, and your breathing's going to go down. I have 2 of the lung diseases, interstitial lung disease, pulmonary hypertension, okay? I have to take the medicine for pulmonary hypertension, interstitial lung disease. That's going to help my lungs function better. It's not affecting my diaphragm because the diaphragm is a muscle. You either use it or lose it. It's just like if you're going to work your biceps. You have to work your diaphragm. All right, so diaphragmatic breathing, we're going to talk about it a little bit, and then we're going to practice it, okay? So when we take a big breath in, what happens is the diaphragm gets pulled down. So here, when you breathe in, this diaphragm's going to get pulled down. When it gets pulled down, the lungs here are going to expand, meaning that you can get more oxygen that is going to go into your lungs. More oxygen into the lungs, more oxygen to the rest of your body. More oxygen to the rest of your body, fatigue gets better, you can do more, and you're not as in much pain because of your muscles are getting oxygen. All right, so when you breathe in or you inhale, that diaphragm gets pulled down, the lungs fill up with nice oxygen. When you breathe out, the diaphragm goes back up, and you're exhaling everything. But remember, if your wheels are not aligned, this is not going to function properly. All right, so diaphragmatic breathing, it is the most natural and healthy way to breathe. And it is the best way for the respiratory system to get all the oxygen that you need. So just to kind of refresh, as you inhale, the belly goes up. As you exhale, the belly goes down. Most of us are breathing the wrong way. All right, so chest breathing. This is how most of us breathe, and this is a very inefficient way to breathe. When we're using breathing from the chest, we are using our neck muscles. And here, this green thing here is called the brachial plexus. It's a big group of nerves that come out of your neck. Right here is muscles called your scalene muscles. They're right through here. When we're chest breathers, we're using muscles of our neck to breathe. They're not designed for that. So what happens is the muscles in your neck stay in spasm all the time. When they're in spasm, it can press on this brachial plexus here and cause the numbness and the tingling down the arm. So a lot of times people come in my clinic and they're like, yeah, I got radiating pain down my arm. You know, my doctor says I need all these injections in my neck, and they're breathing the wrong way. So you can get all these injections in your neck, you can do whatever. But if you don't change the way you're breathing, the symptoms are they're gonna come back, because you've gotta take the pressure off the muscles in your neck. You can get all the massages you want. I love massages, by the way. But you've gotta treat the cause of the problem. The cause of the problem of the muscles being in spasm is that you're breathing the wrong way. All right, so when you're a chest breather, all your muscles up here get tight. A big muscle up here called your upper trap, and that's if you poke right here, this muscle right up in here, everybody's is normally really, really stiff. This muscle can cause headaches, neck pain, jaw pain. Again, that muscle is gonna stay tight if we're not breathing properly. All right, so this is kind of a nasty cycle that we get in for when we're a chest breather. So, one, we're gonna use the accessory muscles to breathe. Accessory muscles meaning your neck muscles, your chest muscles. So what happens is that your neck and your shoulder muscles, everything's gonna get tight. Then that tightness is gonna cause you to go into this forward head posture. Your posture is gonna worsen. Then what happens, that diaphragm is not in the right spot, because now we're like this. So the diaphragm can't be pulled down for oxygen to get in the lungs. So you can't breathe, but you gotta breathe. So what happens, you start to breathe from your chest. And then the cycle just repeats itself over and over and over again. And then you get the symptoms down the arm, then you get headaches, then you get shoulder pain. And this has really nothing really to do with having an autoimmune disease. This just has to do with life and bad posture. So that's the nice thing, is that this stuff can be corrected and fixed. So yeah, we do have lung issues that are gonna impair us, but we can improve our respiration and our breathing. All right. The other thing is chest breathing is associated with an increase in your sympathetic nervous system. And what this system is, this is a system of your flight or fright. So to kind of know what this system is, imagine you're sitting in a waiting room at your doctor's office and you're waiting to go in to get your big results for your medical test. You know, you're trying to find out what medicine you're gonna be on next. You're just sitting there, the doctor's running like 2 hours late. Anybody experience that? And you're just really nervous. Your heart's probably racing, your stomach's probably cramping, you don't feel like you could eat. That is your sympathetic nervous system on fire, okay? Your heart rate's gonna go up, blood pressure's gonna go up, and you're not gonna get as much blood flow to your GI tract. One of the studies that I read said that patients who have scleroderma have an overactive sympathetic nervous system. Well, I mean, if we think about it, we spend our lives in doctor's offices. You know, we're getting told we have this condition, we can't fix this, prognosis is here, here's another medicine, but you're gonna have these side effects, you're tired, you're in pain, you can't go to work. I mean, just talking about it gets me stressed out. We also have tons of GI issues. That's my major problem. When my nervous system is like so heightened just from everything I'm going through, I know when I have to go to my doctors, I just can't eat that day because I don't digest everything. And so some of our GI issues are just the fact that we're just constantly being chased by this lion. So one of the things we can do even just to help our GI system is just to calm ourselves down, which we're going to do through diaphragmatic breathing. Pretty simple. All right, so diaphragmatic breathing. This is going to trigger what's called your parasympathetic nervous system. And this is kind of easy for me to talk about because I just got back from Destin, Florida a week ago. And I don't know if everybody goes, they go on vacation and like your symptoms are a lot better. Like you can eat food, you have energy, you're not hurting as much, you're feeling really great. That's because we're relaxed. The parasympathetic nervous system is just kicked in. So imagine yourself on a beach, nice maybe cocktail if you want. You're getting a massage, you're listening to the sounds of the ocean. That's a lot different effect on your body than if you're sitting in a doctor's office waiting for test results. So the diaphragmatic breathing is going to help kind of trigger this parasympathetic nervous system, which is going to help with stress, anxiety, pain. So remember I said, we scleroderma patients, our sympathetic nervous system is overactive, more so than the rest of the population. So we need to be doing something even more than just the general public to calm ourselves down, to help with our lungs, to help with our GI, to help with our pain, endurance, fatigue, exercise tolerance. All right, so I've kind of talked about all of this. The diaphragmatic breathing, it is just invigorating. It makes you feel good. We're getting oxygen to the lungs. It's going to lower your heart rate. There's so many studies out there on the benefits of yoga and meditation and Tai Chi that they actually lowers your heart rate. I've taken patients in chronic pain who come in with like a 10 out of 10 pain, heart rate over 100. Have them sit down, teach them diaphragmatic breathing, just get them to calm down for 5 to 10 minutes. We'll monitor their heart rate, and their heart rate will drop into the 70s. And they're like, yeah, my pain's a 6 or a 7 now. And they have a little bit more energy. So if you're in a 10 out of 10 pain and your heart rate's in the 90s and the 100s, yeah, you're going to be tired. All right, so now we get to practice it. So the first thing we need to decide is, are we a chest breather or a belly breather? And all you have to do is, what you're going to do is you're going to put one hand on your stomach, and then you're going to put one hand on your chest, okay? And all you're going to do is you're just going to take a breath in. Just take a couple of breaths in. If you need to close your eyes, just to kind of feel which hand is moving more. Now they're both going to probably move, and that's normal. But is your chest moving more? Do you feel your kind of shoulders going up? Or do you feel that hand on your belly kind of going out? How many chest breathers do we have? Yeah, thanks for admitting it. How many people are breathing from the diaphragm properly? Awesome. Have you guys done like respiratory therapy or anything? Or yoga? You just went to yoga. Most of us do breathe from up here, okay? A lot of happened, I'll tell you, kind of going on in my life with lots of GI issues, and when I get bloated and stuff, if I've eaten the wrong food, I feel like I cannot breathe from the abdomen, and I'm breathing from up here just because my stomach's so bloated. And then I come home from work with chronic headaches and chronic neck pain. Or if I'm really busy in clinic all day and I'm like rushing around and I'm not breathing, I come home like, God, why is my neck hurting? Why am I exhausted? It's because I haven't breathed through my diaphragm all day. All right, so in order to breathe properly, you got to fix your posture. So remember, this goes back to, are your wheels aligned? If you're sitting down like this, you're not going to be able to breathe properly, okay? It's going to be very hard. So the first thing is just checking your posture in order to breathe properly. Everybody's like sitting so up nice and tall right now. I think everybody knows they're in a posture lesson. All right, so to show you what to do is really easy. And I don't expect you to get it today, okay? My goal is just something that you can take home. Like I said, I've been doing PT for 16 years. The best thing I can teach any of my patients is proper breathing. Because I know when they leave therapy, they're not going to do my exercises. I don't do my exercises sometimes, you know, I get tired. But you know what, I can breathe properly. So this is the most powerful thing I can ever teach anyone, all right? And all you're going to practice is you're just going to put your hands on your belly. And when you breathe in, you want to try and make that belly get bigger. I think part of our problem in American society as women are like, ooh, I got to be skinny. So I got to suck in, and I don't want to breathe from here because then my belly's going to get bigger and I'm going to go fat. No. All right, let all of that go. So when you breathe in, so if your hands are here, when you breathe in, your belly should expand. When you breathe out, it's just a natural thing. It just comes down. So what I'll do with my patients a little bit easier if you're laying down, because then you don't have to worry about trying to sit up and hold yourself up. So you can be laying down, and I'll put my hands on their belly, or have the patients do it, and say, breathe into your hands, and then breathe out. And what we'll do to try and calm down that nervous system is I'll say, breathe in, 1, 2, breathe out, 1, 2. Breathe in, 1, 2, breathe out, 1, 2. You can make it any length that you want. Like the yogis and people who do meditation, they'll breathe in for like 8, 16. They'll hold their breath for a kind of like 16. They breathe out for 16. It's like insane. But this takes practice. Remember, the diaphragm's a muscle, so you have to train it. So if you're going to PT and you're getting all these great exercises, I tell my patients, make this an exercise. Lay down, put some nice relaxing spa music on, Enya on, whatever. Set a timer for 5 minutes, and that's your exercise, and just practice breathing. You do it with your hands on your stomach, because then let's say you're out in society, you're waiting at your doctor's offices, or you're in Walmart and you're getting stressed out. All you have to do, you put your hand back on your belly, and it's a cue to the brain, oh, I need to start breathing from my diaphragm. Just that cue is going to trigger you to change your breathing, and it's going to help calm you down. So just some tips about it. Many of us, we've been breathing the wrong way. I teach this stuff, and I still do it wrong when I get stressed out. It's just the natural tendency for us to go back into that sympathetic system, that flight or fright. So all day I'll be walking around and I'm like, oh, gotta put my hand here, and then it automatically just changes my breathing. So remember, it's a muscle. You use it or lose it. Yeah, I need my Revascio and I need my prednisone for my interstitial lung disease, pulmonary hypertension, because it's going to give me the blood flow that I need. It's not affecting my diaphragm. My diaphragm is a muscle. It has to be trained. Yes, I need that medicine, but then I need to use that medicine and train my muscles. All right, so physical therapy. This is if you just kind of want to make it a little bit more challenging. You can like put some shoes on, you kind of see which one shoe is rising higher. You can put a water bottle. Sometimes people put like a little weight on it just to kind of train it a little bit. I like just trying to do it longer and longer because we breathe throughout the day. But try it laying down, and it's going to be a lot easier for you. Anybody able to get the diaphragmatic breathing, just kind of practicing? You're going to feel a lot better, and your digestion is going to be a lot easier. I try and remember, like before I go and eat, just to put my hand here, because like I'm running around all day, and I'm in this state of just kind of all flared up, and then I go eat. So my nervous system's all flared up, which means I'm not getting blood flow to my GI, which means I'm not going to digest my food, which means after I eat, I'm going to feel pretty horrible. Before I eat, all I do, assess my breathing, put my hand on my stomach, take a couple of minutes. Am I breathing properly? Calm myself down, then I digest my food better. All right, so you've been to physical therapy, so awesome. So sometimes we can't stay in that good posture just because our muscles are weak. So here comes when you want to go to your physical therapist, and we can teach you just simple exercises just to kind of help strengthen up the muscles in your neck, strengthen up your back muscles. Many people say, well, when I sit up, it hurts. Well, it hurts because those muscles are weak. So this is where PT comes in. Even if you can't go a lot, just go to learn the exercises of what to do at home. All right, so we're going to kind of change gears and just talk a little bit about expelling the fear with exercise. So everybody says you need to exercise, you need to exercise. And unfortunately, you turn on the TV and you see things like The Biggest Loser, or extreme weight loss, and you have all these people exercising for like 8 hours a day. Or you look at your local gym, you see Zumba, and you see all this high impact stuff. I can't do that stuff. I would be exhausted. So then what happens, like, well, we don't want to exercise because we can't do that. No, we can. So we're going to change the word, the concept, the word exercise. We're going to define it as any meaningful, enjoyable activity where the body is moving. So everything you kind of thought about exercise before, Zumba and CrossFit and all that stuff, take that, throw it in the trash. It's going to be anything where you're moving. Because the research shows that for heart benefits, we need 30 minutes a day. But that can be broken down into 10 minutes at a time, 3 times a day, to get benefits. So we don't need to be doing all this high impact stuff. All right, so some things that are very beneficial that we can do as scleroderma patients is chair yoga if you can't do a full yoga session. And I know there's a video out there of yoga for scleroderma patients. It's great. I have the video. Tai Chi is wonderful. You can even do Tai Chi in sitting. And the thing about Tai Chi is it's very calming to the nervous system. It's really going to calm you down. It also helps with balance. I do a lot of Tai Chi with my patients just to get them calmed down, because sometimes they come in and they're in such pain and they're so overstimulated that I can't even work on them. So what I do is teach them breathing. I'll do some Tai Chi movements with them just to get them calmed down. Water aerobics, I love water aerobics. It's very soothing for the joints. This is my favorite, mall walking. Although sometimes I tend to stop a lot in the stores and take out the credit card. But just, if you like going to the mall, just walking in the mall and just people watching and stuff. All right, so don't forget everything that we have to do during our daily lives. Ironing, vacuuming, going to the grocery store. Sometimes if I haven't had time to exercise all day and I have to go to the grocery, I'll make it a point to walk up and down every aisle just to get some exercise that day. That could be your exercise for the day. Your body's moving. Although I don't know if this is an enjoyable one for me, but that takes energy. This is what I love, expelling the fear with exercise. Just dance, just get up and move. Some of the best things is just put on some music if you like and just get up and dance. Just get the body moving, just act crazy, just move. Okay. Any questions so far? All right. I think this says it all here. I know a lot with this illness, we get told a lot of times by our doctors, we can't do this, we can't do this, we can't do that. And some of the things that come with exercise and fear is what our doctors, have told us. I recently saw a patient, and she had a doctor tell her 10 years prior that her back was broken. So for 10 years, she didn't want to move because her doctor told her back was broken. Her back was fine. So sometimes, things that we hear kind of get into our brain, or we get told, we have this disease, you have a bad shoulder, you have this. And sometimes we need to let that go, get evaluated by a PT, see how you can move properly. Some people come in with shoulder pain, and it's like they've been told I have rotator cuff, I shouldn't move my arm. That's the worst thing for it, is not to move. It's learning how to move properly. All right, so to try and increase your exercise tolerance, all right, start at 1 to 10 minutes a day. Then you can gradually increase it. It was 2006, I went into liver failure. I spent about 2 weeks in the hospital. They didn't think I was going to make it, told that I needed a liver transplant. I still have my same liver. When I got home, I think I slept probably for 23 hours a day. My exercise at that point became one, getting up, just sitting up in bed. Then I gradually made it and walked to the room where my treadmill was at. That became exercise. I would walk, sit in my chair, and I probably had to take about 5 or 10 minutes just to get my breath again. Got on my treadmill, and I would walk for a minute. That's where I started. After a minute, I'd have to sit down, probably wait 5 or 10 more minutes, and then walk back to my bed and probably slept the rest of the day. But I had to start somewhere. People say, well, I'm so sick, I can't do anything. No, you can. That's why you have to let go that concept of the whole CrossFit and Zumba, because sometimes we can't do that. So for exercise for me was walk into my treadmill, walk 1 minute. My goal was, next time I'm going to walk 5 more seconds. I'm going to walk 10 more seconds. And so how I started measuring my progress is, I got to the point where I could walk from my bedroom to the treadmill, walk on the treadmill for a couple minutes and back to my bedroom. I was so excited because I didn't have to sit down. Yeah, I wasn't doing Zumba, but I was exercising. That was exercise for me. So you have to start somewhere. People are like, oh, I can't do anything. Walk 1 minute. The next time you try and go 5 seconds more, 10 seconds more. All right? So your goal you want to get up to is 10 to 30 minutes, 5 to 7 days a week. Okay? You can split up this 30 minutes into 3 sessions of 10. Research shows that for cardiovascular benefits, that's just as good. All right? So if you're breaking it up, you're going to decrease your pain and your flare-ups. This is actually from a fibromyalgia research article, which many of us get diagnosed with that too. So the point is that just start somewhere. And also remember to include all the walking you've done throughout your day. So if I've had a busy day in clinic, or if I've spent all day like running errands and everything, I'm probably not going to exercise that day because I'm already tired. So just kind of remember everything you're doing throughout the day. Our hardest part when we're going to exercise is that we don't make our goals very realistic. We're going to be like, I'm going to exercise every day this week. And then what happens? We miss 1 day. And it's like, oh, I already missed today. That ice cream really looks good. And well, you know what? I'm going to miss tomorrow anyway, so I'm going to put some hot fudge on that ice cream. And then we give up. All right, but I've done that. So make a goal that's realistic, because when you start meeting your goals, then you're more likely to keep going. So don't make a goal saying I'm going to exercise 5 days a week. It's probably not going to happen, okay? Make a goal. I'm going to exercise 1 day this week, and I'm going to exercise for 10 minutes. That's my goal for this week. You meet that goal, and then you feel more positive to maybe increase it the next time, all right? And also, rest is important, which probably everybody's going to do after attending this conference, is just go home and sleep. The other thing when it comes to exercise is we say, I need to exercise to lose 10 pounds. Step on the scale, it didn't happen. Anybody ever do that? Yeah. So don't make a goal with exercise to lose weight. That's not important. And I mean, It is, but that's not what you should be focusing on, okay? Make goals that improve the quality of your life, okay? Maybe your goal is, I had a patient, she wanted to be able to climb up the steps to go to the Sanger Theater to see a show. That's a goal. That's a realistic quality of life goal. So she comes back saying, yeah, I was able to climb up the steps and go out with my husband to see a show. That's what we should be focusing on, all right? My goals when I was coming back from the liver failure wasn't I'm gonna walk 10 minutes on the treadmill. You know, I started kind of thinking, can I stay up, you know, longer than an hour a day? You know, can I go to the grocery store without getting exhausted? That became my goal. So I used the exercise to help improve my overall function, all right? Also, endurance with daily activities. You know, can you last longer when you go out to a restaurant with your family or go to an event like this? Decrease pain. Exercise brings our endorphins. It's a natural, it's the best thing to help reduce our pain. It's the best thing for depression. Okay, so maybe when you're exercising, you know, you're not as sad. That's a good goal. All right, improve your stress levels. Everybody's stressed out these days, you know, so when you're exercising, you know, rate your stress levels. Is it normally a 10? Maybe when you're exercising, it comes down to a 5. That's a good goal. All right, improve your body image and self-esteem. Lord knows we need that with this disease, right? Improve your sleep. The days that I exercise and dance, man, I sleep the best ever, all right? Sleep is so important. It's when the body repairs. It's when the body restores itself, okay? If you're not sleeping, you're not healing. Patients who come into me and they're like, yeah, my pain's really bad today. I'm like, how'd you sleep last night? They're like, how'd you know? I didn't sleep at all. I'm like, yeah, I can tell. All right, so if you're exercising and it helps you sleep better, that's also a good goal. So take a look at your life and see how the exercise can improve your overall functional abilities, not just worried about a scale. All right, and just kind of remember, you don't have to see the whole staircase, just take the first step. And I just kind of want to tell you a little bit about my journey, just how so many times I think I have crashed. I think I climb up a little bit and then I crash. And then I climb up a little bit more and then I crash. This has been going on for 16 years. I first got diagnosed when I was about 25, 26. I was right out of PT school. And I started with the interstitial lung disease. And at that point, it was you have 5 years to live. Like 5 years? Well, that's not nice. After that, I did a year of oral Cytoxin. And all of that was just still trying to work, trying to increase my exercise tolerance, climbing up a little bit, coming back down. I also did a 6-month cycle of IV Cytoxin for interstitial lung disease. All that time, I would improve my exercise tolerance where I'd maybe be exercising 5-6 days a week. Start chemotherapy, and you know what? Ooh, just staying awake was my exercise. But again, I would slowly come back up and increase my exercise tolerance. Yes, I'd get to the point where I'm exercising every day, I'd do Cytoxin, and then I'm sleeping all the time. And I kept having to start over. That's what this disease is. I also went into severe pulmonary hypertension. Again, I had to restart with my exercise tolerance. Liver failure. Again, restart exercise tolerance. I was doing very well, and then I got the deadly GI infection, C. diff, twice. Once wasn't enough. I decided I had to do a second time. I got cured with that by having a fecal transplant, saved my life. Unfortunately, I ended up with the small intestinal bacterial overgrowth. I dropped down to 86 pounds. Again, all this time, I'm still trying to do a little bit of exercise. For me, exercise was going to the mall with my mom, was still getting up, just moving, doing diaphragmatic breathing, So yeah, I was 86 pounds, but you know what? I was still trying to do something. Yeah, I wasn't doing CrossFit or anything like that, but I got up and I went to the mall. You know, if I could walk a while around Walmart, that was great. So after that, my doctors put me on a new medicine for GI. We didn't realize I had a sulfur allergy. I think I dropped down to about 83 pounds. At this time, I'm still working because you got to keep pushing through it. I ended up with a PICC line in my arm for 5 months, having to do IV nutrition in order to sustain life. Recently, last month, got the PICC line out. I now have a port for the second time. The first port was for IV chemo. Now I have the port doing IV nutrition 2 or 3 times a week. And all through this process, I have gone up so many times, and I have come crashing down so many times. And I think my story of telling you guys this is to know that this disease is no longer it is life-threatening, but it's no longer that severe, you have 5 years to live, okay? It's become just a disease where you learn to manage it. And during probably the hardest times, I rest, and I don't make any decisions, and I just let my body be. And I just kind of take in what's going on. The biggest thing that helps me control all my symptoms now is doing the diaphragmatic breathing and trying to calm my body down, because my body stays in this state of just being so overstimulated. And society doesn't help. I mean, we're so fast-paced now, on our computers, watching TV. It just is very overstimulating. I've learned just to turn the TV off. I don't even really watch it anymore because it's so overstimulating to me that if I'm watching TV, I can't sleep at night. For me, sleep's important. I need my 8 to 9 to 10 hours of sleep. If I'm not getting that, I'm not functioning as good as I need to. So this disease, you can manage it with, proper exercise, just proper learning to control your stress levels. That's the end of this talk for posture and breathing. If anybody has any questions, I'll take questions. And if anybody wants to talk about the dietary changes I have made to keep going, we can talk about that as well. I believe so. When my pulmonary hypertension got very bad, I was on Letairis, and I was taking 8 Revascio a day. I'm now only on 1 to 3 Revascio a day. I used to use oxygen kind of during the day when I was at home and at nighttime. So I needed the pulmonary medicine to improve like the blood flow and stuff to the arteries. But no, the diaphragmatic breathing has greatly helped it, because I noticed what happened is after with the interstitial lung disease and the pH is that everything gets restricted. And you have a hard time expanding your chest because of all the restrictions. You get the medicine to help improve it, the changes inside the lungs, but then you're not teaching the breathing to retrain the improved function in your lungs. So that's kind of the missing piece of the puzzle that I believe. So yeah.
Like the breathing during the exercise that you are getting. So do you need to
You really need to focus on that. So what I have all my patients do, and I practice it, is you make breathing as a formal exercise. Like if someone's going to tell you you're going to walk on the treadmill 10 minutes, you're going to breathe for 10 minutes. That's all you're going to do. You're just going to work on that breathing. All right, put your hands on your stomach. And then what you have to do all throughout the day, you have to reassess your breathing. So maybe every time you check your phone, every time you go to the bathroom, every time you pick up the phone, assess what's going on with your breathing. And then when you start to exercise, you need to reassess the breathing. That's why I do like things like yoga, because it really talks about the breathing and incorporates that versus doing like, a lot of high impact aerobics, okay? I can't do the aerobics anymore because I can't get my breathing with it. It's too much. So I do more things like just, walking around, I can assess my breathing. Yoga is great, Pilates is great, more low impact stuff. So yeah, it's a constant work that you have to continually do. The 3 wheels, okay. So 2 good exercises, you can do them in sitting, is just kind of, so if you're kind of in this forward head posture, all you're doing is just kind of putting your hands on your chin, and you're just gently kind of tipping it kind of down. So it's like you're trying to make your head do that. Just kind of going down, just like that. And you want to kind of, like, this is just kind of a cue here, but you want to use your neck muscles to do it. And I have my patients working on holding it like for 5 to 10 seconds, kind of throughout the day. So a lot of times when you're like that, it's just kind of gently tipping it down. And the other one that'll help is to get you in a good posture. You know that one, I can see. Yeah, because the thing with the dizziness is when you're like this, these muscles called your suboccipital muscles get really tight. And you have nerves that go through these muscles that can cause the dizziness and the headaches. So you just kind of tip it forward to get the wheels aligned. The other one is just called a simple shoulder blade squeeze. And all you're doing is just imagining that like someone's pinching you back here and you're just squeezing back. Just like that. So you're just squeezing back. You're just trying to stick your chest out. Okay? I used to have my 93-year-old grandmother do this one all the time because you get like this. So the neck tuck and this one are the 2 most powerful exercises I give my my patients. And it's something you can do while you're sitting here. You can do it while you're driving in a car. Like I said, I'm a PT. I talk about this all the time, but I still have to watch my neck, squeeze my shoulder blades, and it's a lot easier in standing versus sitting. What I would do is I would just call like the clinics and ask them if anybody is experienced with working like with rheumatology conditions. You can also go on the, our website is the APTA, American Physical Therapy Association. Under there, I think there's a site where you can find certified specialists like myself. My certification's in OCS, so I'm an orthopedic clinical specialist, meaning that we took a grueling exam to get where we are. And we're gonna have more training. We're gonna be up to date on the latest research on what to do and what not to do. So if you go on the APTA, you can look under your state and you should be able to find an OCS specialist. That would be my, OCS. And then just, call and ask if there's anybody who deals with even cancer or chronic conditions, but trying to find someone with an OCS was probably the best. And if you have any hand issues, the best person to find is a certified hand therapist. They can actually either be a physical therapist or an occupational therapist. And these people also have gone through extensive training and study, and that's basically all they do is the hands. So to find a certified hand therapist if you're having any hand issues. All right, so my dietary, I am a firm believer in being gluten-free. I recently saw an endocrinologist at LSU, and she told me that any person with any autoimmune disease should be gluten-free. My liver specialist, I went and I was like, I don't feel good when I kind of eat a lot of greens and carbohydrates. He's like, I don't know why you want to eat them anyway. I've done a lot of research on gluten, and even if doctors tell you that your antibodies are negative for celiacs, I think you need to do the gluten-free challenge, meaning for 2 weeks you don't eat gluten. No gluten whatsoever. The biggest mistake people try and do with gluten is they're like, well, I'm kind of gluten-free. Going gluten-free is like being pregnant. You either are or you aren't. After 2 weeks, eat your gluten and see how you feel. For me, I have stopped the progression, reversed it, have gotten my life back by going gluten and dairy-free. My biopsies on my GI colonoscopies were a mess. I recently just had one, they're fine. It's because of the dietary changes. My lungs, like I said, I was on Letairis ate Revascio a day, oxygen at night. I was on disability, it couldn't work. I was on fentanyl pain patch, excruciating pain, told I had fibromyalgia and all that fun stuff. And finally, I just got fed up with everything all my doctors telling me, you know, it keeps progressing. So I did a lot of research into autoimmune diseases and going gluten-free, and it totally reversed my progression. So I am a firm believer that anybody who has any autoimmune illness needs to try going gluten-free. And what they find is that gluten actually causes something called leaky gut, and it pokes little holes in your gut. And then what happens is you start to eat stuff, kind of gets outside of your gut, and your body starts reacting to it and causes an autoimmune process. Some people don't want to do it because it is hard. You know, it's gotten easier now trying to be gluten-free. For me, I had to go gluten and dairy-free because dairy can also be a very inflammatory food. So I pretty much eat all the protein I want, you know, like chicken, fish, pretty much eat all the vegetables I want. And then like for my carbohydrates, I'll do rice or like quinoa. The biggest thing is trying to stay away from the sugars, which is definitely difficult. But even when I have too much sugar, my brain's not functioning so good. I'll know if I eat like too much like cashew ice cream, because I wake up the next day, my joints are killing me, I'm in a lot of pain, and I'm just exhausted. So it's a very challenging diet, but I wouldn't be standing here, I wouldn't have my life back, I wouldn't be back to work without the changes. So a lot of the changes that we have with all this chronic pain and stuff is what's happening in the gut. And the gut is 70% of your immune system. So if you can control what's happening in your gut, you can control a lot of the illness. So you can look at things like the autoimmune paleo diet, or just has a good protocol just to try and kind of help you out. So, and it's something I went, you know, personally, and then my doctors started saying, yeah, you need to be doing that, even though my antibodies for celiac test negative. But I have reversed it and stopped my progression and have gotten my life back because of the changes I've made. Well, thank you guys for coming. I appreciate it.